Hello, my name is Annie Covington, and I'm going to do my speech on general anxiety disorder. Your heart starts racing, your hands sweat, your body starts to shake, your breathing becomes irregular and rough, your mind's racing, focusing on everything and nothing. You feel lost. These are some of the symptoms that people with general anxiety disorder have to deal with, sometimes on a daily basis. General anxiety disorder is a disorder of the mind that is that a pattern of frequent, constant worry and anxiety over many different activities and events. General anxiety disorder is a disease that plagues many people, whether it's from genetics or from stress. It's interesting to know that according to the National Institute of Mental Health website, that 4.1% of the adult population suffers with lifelong anxiety, and that 18.1% of the adult population suffers with a 12-month prevalence of the disorder. Personally, general anxiety disorder is something that I've been plagued with for many years in varying degrees, so learning more about it helps me to understand myself and those around me who have the disorder as well. Today I'll give you a brief overview of the disorder, helping to give a better insight of the disorder and for those who suffer with it. Clearly, anxiety disorder is not an uncommon occurrence, and understanding the causes of it, the symptoms of it, and the treatments can help those around us who have it. First, let's go over some of the causes of general anxiety disorder. Although the exact cause of GAD, or general anxiety disorder, is unknown, two of the main factors are determined as possible causes for general anxiety disorder are stress and genetics. The causes of GAD have been boiled down to stress and genetics because those two factors have the most influence on our lives. In life, we go through a lot of stresses, some of them healthy and others a lot more difficult to handle. When these stresses become too much, sometimes our minds are not able to handle it well. Some people with the pressure gain general anxiety disorder, and their minds are not equipped well enough to be able to handle the stress well. Another factor that has been determined as possible cause is genetics. If one has GAD in their family history, sometimes it makes it more likely that they will develop GAD themselves. Personally, I know this is accurate because my mother suffers from symptoms of GAD, and so do I. GAD is a disorder that has not fully been determined as to what the cause of it is, but with this information, we are more able to prepare ourselves to understand those who may have it and who are possible to get GAD. Now that we understand a little bit more about some possible causes of GAD, let's talk about some of the symptoms. GAD has many symptoms, ranging from physical symptoms to mental ones. Three of the main symptoms of GAD are stomach problems, muscle tension, and fatigue. People with GAD sometimes have stomach problems such as diarrhea or nausea. These stomach problems might not be seen as a result of GAD at first because diarrhea and nausea are symptoms of a variety of other disorders or sicknesses, but if it is a persisting problem, it is better to go see a doctor so whoever it is that might have GAD can actually determine what the actual cause is, and sometimes it might be GAD. Another symptom of GAD is muscle tension that can be shown in shakiness or headaches. If someone suffers from migraines when under stress, or if one gets shaky when dealing with stress, that could be a sign of GAD. Sufferers of GAD also suffer with fatigue in a variety of ways, such as sleeping problems and possibly hyperventilation. Sometimes people who suffer with GAD cannot sleep or sleep in inappropriate forms or times. For instance, if they're in class and they fall asleep, even if they have had plenty of sleep the night before. Another form of fatigue can be shown through hyperventilation. If one is suffering from a stressful situation, someone with GAD can suffer from a panic attack that can be brought on, which causes hyperventilation. These are some of the many symptoms. These are only a few of the many symptoms that can result from GAD. But these three categories of symptoms are some pretty good indicators of the disorder. We've gone over now some of the causes and symptoms of GAD, but let us now move forward and go to some treatments of the disorder. There are many ways to treat GAD, most of which are actually not involved with seeing a doctor or a psychiatrist. Some of the ways we are able to treat GAD are cognitive behavioral therapy, medicine, and a healthy lifestyle. With cognitive therapy, behavioral therapy, or CBT, one learns how to recognize and change thought patterns and behaviors that lead to anxious feelings. That is one way we are more able to recognize when someone is starting to have an anxiety attack and control their mind so they can be able to calm down. Medicine is another way to treat GAD. The most commonly used kind of medicine to treat short-term GAD is a category called benzodiazepines. Antidepressants are also used to treat GAD. And the third and possibly most helpful treatment of GAD is to have a healthy lifestyle, staying away from caffeine, eating a balanced diet, having a regular workout schedule, as well as getting enough sleep. Also, having people in your life that you can have healthy relationships with can also add to the treatment of GAD. GAD is not completely hopeless cause, and if one is diagnosed with GAD, one is able to get the help they need in order with treating this disorder. After going over the causes, the symptoms, and the treatments of GAD, one should be able to at least have a good idea of someone with GAD suffers with, and possibly if you might suffer GAD and not know about it. General anxiety disorder has many causes. Some we can do something about, and some we can't. And a variety of symptoms are something that are hard for people to deal with. But if we learn more about the disorder and do our best to lessen the stresses of those who do have the disorder, or even if we have it, lessening our stresses so that we may be able to learn to cope with the stresses that come with life, we will be able to help ourselves if we do have GAD or those with this disorder, and be able to make life a lot happier and a lot easier. Thank you.